most of my patients will be asking me, do I need a birth plan? What is a birth plan? Okay, like what I mentioned just now, that is the routine way that we tend to manage labor. Okay, so you may need to write a birth plan if you think you might need to deviate a little bit from the usual way in which we manage. So for example, like uh, uh, if you don't want any pain relief or any suggestions of pain relief, then you write it down, because otherwise when the midwife sees you in pain, naturally she'll ask, would you like to have some painkillers, right? So for some women, they don't want any suggestions because they are afraid that that might tempt them to have a pain epidural, for example. And some may prefer intermittent monitoring, meaning that they just monitor for about 20 minutes, then they stop in between, and then they get the baby on again. This allows them to move around in between rather than to be strapped on the bed. Okay, you may want to explore different positions for laboring or pushing. Like some people prefer to be on their knees instead of the conventional on the back with the legs up. Okay, um, uh, some of my patients will ask me about episiotomy, perineal tearing. This I will go through slightly later. Immediate skin to skin or drying the baby first, because the general thing that the nurses will do is that they may dry the baby first before they actually let you do skin to skin. Okay, that, I mean, makes the baby a bit more comfortable, because imagine if you come out from the swimming pool all wet, you're going to feel very cold. So similarly, the baby would feel very cold. So drying them up helps them. But if you would like the immediate skin, it's not a definite no. We can still do it, so you need to put that down so that the nurses know what your wishes are, and we will try to, of course, follow that as far as possible wherever it's safe. Delayed cord clamping. What is delayed cord clamping? It means that instead of when the baby comes out, usually we'll proceed to clamp the cord and cut the cord, right? In delayed clamping, we hold off a little while to allow more blood from the mom to pass through to the baby. Usually that may last for a couple of minutes or so, not that much longer, so that the baby gets more iron cells, red blood cells for more iron. Pros and cons, I think is more a trend thing. Okay, so this is the trend thing. The pros is that the baby will get more iron stores, so less chance of anemia. The bad part might be the baby's jaundice level may tend to be a little bit higher, because with that extra blood cells that will definitely break down to form new blood, will give rise to a higher bilirubin level, you see. But nothing too detrimental. I mean, I wouldn't say that it's a dangerous thing to do that either. So I think it's your preference. And of course, if you are thinking of storing your the baby's cord blood, then delayed clamping may not be a good idea, because there isn't very much blood, will not be very much blood that we can collect after that. Okay, this is like an example of a template. So some people want the easier way out, right? Then you can actually check online. There are some templates that you can download. You can tick, cancel, see whatever you want. This is just an example. It doesn't mean I'm for all these things or so. So it's just something that you can explore. I think having a birth plan can be also a good idea, because it makes you think about how you might want your labor process, or to give you a chance to discuss this with your doctor, and it opens up topics for discussion, things that you may have never thought about, and helps you understand the whole process a bit better. Okay, but if let's say your idea is, oh, well, it sounds like a lot of work, I'm just going to go with the flow of things, yeah, you can leave it off. Nothing that you have to do, not that you have to do this homework. Okay,